didn't come for the strong, you're here for the broken. This is my song of intercession, God. Only you know. Only you know how it feels inside. This pain when you try to hide it. Afraid to cry for help, you smile and drown it out. Only you know how it feels inside. To try and try and try and try and try and fail. Only you know why you say the clock and he's not home. Out with his boys drinking, 'cause he knows when he goes home and opens that door, it's another night of fighting or silence. Oh, she's cutting up deep, and they just think that she's crazy, but you know better, doc. You know she's being touched in the wrong way. Oh, doctor, can you heal him? I pray, 'cause if you don't, he will not make it. Doctor, can you heal her? I pray, 'cause if you don't, she won't make it till the morning. Doctor, can you heal them? I pray, 'cause if you don't, they will not make it. Doctor, can you heal them? I pray, 'cause if you don't, they won't see the morning. Oh, 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 oh. Only you know how she feels inside. These feelings she's trying to hide, that's for another girl. It's not supposed to be. Only you know she prayed and prayed. How much she is afraid to get the help she needs, that your blood can set her free. Oh, only you know he's going to church but losing hope, 'cause he's tired of repenting for the same things over and over. It's almost over for him. Only you know I'm surrounded by broken people, and they need a hero 'cause they can't face what's wrong on the inside. Your boy's here and deceiving. Doctor, can you heal her? I pray, 'cause if you don't, she's not gonna make it. Doctor, can you heal her?
Hi, a pleasant good evening to one and all. Welcome again to Heavenly Medicine, and I'm your host, Dr. Zayniah Louison, as we present our 9th episode with our topic today, the prostate and prostate cancer. Okay, so joining us again for our episode is Dr. Azel Baptiste. So we just want to welcome you again, Dr. Baptiste. You can feel free to say hello to everyone, because I know we are looking forward to hear more from you concerning the prostate.
Thank you much, Dr. Louison, my dear friend, for once again having me on the program, Heavenly Medicine. And today we're talking prostate disease, but specifically today we're speaking about prostate cancer, which is so very important, and we want to raise awareness, especially with the men population. That's who we're targeting, because an issue that affects predominantly men. So we want you to like, subscribe, share, tell your friends, your family, your uncle, your daddy, your neighbor, whoever you think that might, or whoever man that you have in your life, you'll share with them and you let them know. All right.
Okay. All right, guys. So we want you, as Dr. Baptiste just said, please share, subscribe. We want to welcome you wherever you may be, whether you are on YouTube, Facebook, or listening on 103.1 FM. We want to welcome you to join in with us on Heavenly Medicine as we discuss the matters of the prostate. Okay. Today, especially, we want to focus in and zoom directly on the prostate in pertaining to prostate cancer. All right. So again, good night to one and all. I hope you are ready to hear more information on the prostate men, whether brothers, uncles. We just want you to join with us and listen in, tune in, guys, as we give you a wealth of information pertaining to the prostate. So what we're going to do first, we want to share a quick video with you, and then we are going to actually get into more information. So we're looking forward for persons to send their messages, ask questions. This episode is a continuation from episode number 8, where we are allowing you to call in. You can ask your questions, anything that you would like to know further that was not said or mentioned. This is your time. This is your occasion today to ask Dr. Baptiste some questions, ask myself some questions, guys. Don't be afraid. So we would just like to share a short clip with you. We hope that you would just enjoy, sit back, relax, and enjoy as we continue this episode today.
Embarrassed. Too embarrassed to speak to a loved one. Too embarrassed to speak to your doctor. Embarrassed. Too embarrassed to speak to a loved one. Too embarrassed to speak to your doctor.
Too embarrassed. When in our lifetime, 1 in 4 black men will be diagnosed with prostate cancer. 1 in 12 black men will die from prostate cancer.
Let me repeat that. 1 in 4 black men will be diagnosed with prostate cancer. 1 in 12 black men will die from prostate cancer disease.
1 in 12. That could be your dad, even your older brother, uncle, or grandfather.
You need to make sure they are not embarrassed to speak to you or their doctor about it.
Hey, Dad, have you had your prostate checked out? See? How hard is that? It's easy. Just start the conversation.
Prostate cancer is survivable if caught and treated early enough.
Don't let embarrassment stop you having this important conversation.
You may save someone's life.
Not just your own.
Okay. Wow. So I hope everybody that viewed this video enjoyed it, because the point that we're really trying to get here to the public is that we know the stigma, we know the challenges that even us as healthcare physicians face when it comes to the male sex. It's very difficult to get them to come in on time to see their doctor. And we want to change the mindset. We want to remove those taboos of whether, okay, I'm a man, I don't need to go I don't need to see a doctor. So I'm hoping that whether you may feel embarrassed, whether you may think it's not a manly thing to do, we just want the public to be aware, especially we're reaching out to our men this evening. Please do not be embarrassed about going to see a doctor. Please do not be embarrassed to actually get a prostate test done. All right. Last episode, we did mention the test. We talked a little bit more about it. But I'd like Dr. Baptiste to just, we're just going to do a quick summary as to the prostate again, because we want all our viewers who would have missed last episode to have an idea as to what the prostate is, where it's located, and so on. And then we'll move into more details from there. How you think about that?
Most definitely.
Okay, Ben. All right,
So,
great.
just to piggyback off the video that was shared, all right, the statistics when it comes to men, especially black men, because we're more at risk as a black nation or a black population than Caucasian men or even Asian men.
That's
All right.
correct. Mm-hmm.
From the video, it stated that 1 in 12 black men will be diagnosed with prostate cancer, and that is an astronomical figure. Imagine 1 in every 12 or 10 black men being diagnosed at some point in their life with prostate cancer. And it goes further to state 1 in every 4 black men would die of prostate cancer. So we need to have the conversation. We need to reach our men. We need to speak to our family or uncles and so on, and we need to get them to get tested and get screened so that we could detect early. And that's the whole purpose of, that's the whole aim of this this evening session, is to create awareness, sensitize the population, and encourage them to go there and get treated, especially when you're reaching that age group over 40 where you're at risk. All right, if you know you had a brother, a father, a uncle that had prostate cancer, the likelihood of you getting prostate cancer is even more increased. It's a risk factor. So that is the whole intention of today's session. All right. So let's speak a little bit again about the prostate. So we said that the prostate is a little gland that is located just below the bladder.
Yeah.
So we have our bladder, we have our urinary system, all right, where we have our kidneys. Our kidneys, we have 2 ureters that goes down to the bladder. There's a urinary bladder, and just below the urinary bladder, there's this little walnut-shaped gland that is called the prostate. All right. The purpose of the prostate, we already spoke about it. It creates enzymes. It creates seminal fluid to nourish and so on the semen, so that it has other purposes like as I said, the enzymes and so on that it creates, and it is basically to create fluid for the sperm, for the spermatozoids. All right, but that gland could cause a lot of problems. All right, it's a very small gland, the size of a walnut, as I said, but it creates, and it could carry a lot of problems, especially for men. All right, we spoke about prostatitis in the last program. We spoke about benign prostatic hyperplasia, and today we want to zero in on prostate CA, which is the whole the idea of today's session. All right, so that little gland, we said it has it is made up of different layers. All right, we have the peripheral region that we said is basically the purpose of it is to secrete the cells and so on. There are secretory cells. We have the transitional zone, whereas in that zone is where we predominantly have the benign hyperplasia emanating from, and also we have the central zone. All right, and we will speak more about the peripheral zone, especially as we were speaking about prostate CA, prostate cancer. So we'll speak more of that zone, because that is where, and the posterior lobe, because that is where prostate cancer generally tends to originate from. Although it could originate from different layers, but generally that is where it originates from, that posterior lobe.
All right, and yes, we did talk a lot about prostatitis in the last episode. We talked about benign prostatic hyperplasia. We talked about, the difference between it, as in this case it's benign, where it's not cancerous, but then we also instead of that, we're now going to look at where it's cancerous. So Dr. Baptiste, what would make the prostate from being benign to cancerous?
Okay, so first of all, let's somewhat define what is a cancer. All right, a cancer basically originates from a group of cells that doesn't respect the normal rules for cellular division and so on. So we have our cells in the prostate gland, and some of those cells, generally the cells supposed to follow a natural scheme of things. So we have something that we call cell growth. We have what we call cell death, because the cells would normally live for a particular a number of days or a particular amount of time, and then afterwards they would die, a process that we call apoptosis. But in cancerous cells, what we have is that those cells, they don't respect certain rules. All right, we have certain things that are in place. For example, the oncogenic, what we call oncogenic promoters and so on, and those things, they promote cell growth and so on. And in cancer cells, we have an overgrowth of those cells. All right, they divide, they continue to divide, and they don't really die. So they don't respect that, and then they go on to invade other areas that they're not supposed to invade. So that is where we get cancers from, and generally that is the whole idea of a cancer. In prostate cancer, the same happens. All right, we have that cell which multiply. It keeps multiplying. It keeps growing, and then it goes to different areas that it's not supposed to go. So you travel sometime to the seminal vesicle. It will travel to the lumbar area, to the bones. You travel to the liver. You travel to the lungs. All right, and that is where it becomes dangerous when we do not detect it in time, and when it travels. So it causes a lot of problems, not only just problems in the urinary tract system, but it also could cause generalized problems for your lungs. It could travel to your brain. It could cause liver invasion and all those things.
Okay, all right, well said. Okay, so looking at the actual prostate, so we can see now here we have a diagram illustrating some of the different lobes of the prostate. So from the last episode, you mentioned the anterior lobe, we talked about the lateral lobe, the middle lobe, and the posterior lobe, right? So where exactly within that location would a cancer most likely be lodged with the prostate?
So, yes, as we said last week, not last week, 2 weeks ago, sorry, the prostate cancer generally, it would stem from that posterior lobe.
Okay.
We have the two lateral lobes, we have anterior lobe, we have a middle lobe, and we have the posterior lobe.
Okay.
Generally, the prostate cancer, what we call carcinoadenoma, carcinoadenoma, it would stem from that adenocarcinoma, it would stem from that posterior lobe.
Okay.
All right? So that is why sometimes, especially when we go to our doctors, the doctors tend to do that digital rectal examination to see where, if there is any, what we call nodules, any hardening, any calcification of that region, because it generally tends to stem from there, and that is where we could basically access on a physical examination.
Okay, and I'm happy that you mentioned again the digital rectal exam, because I think this is the thing that we are trying to sensitize the public about. And I think that is where most of the men in our society can be a little bit, that's where the embarrassment comes.
Definitely.
Because there is a taboo as pertaining to that exam. You know, we call manly man, and where they may think,
macho man.
Yeah, the macho man. And where they may, just the whole idea of the test, or sometimes people hear rumors, so they're not too sure exactly what it's about. But can you just fill us in a little bit more as to the DRE, and in terms of in terms of sensitizing the public that it's not as that horrific as they may appear, as people actually make it seem. Okay,
so the digital rectal examination, all right? As we said, in the prostate gland, the location of it is basically seated right beneath the bladder. So from the rectum, from the anus, we have the anus, then we have the rectum. From the rectum, that is where we could, as physicians, that is where we could sort of access it. Yeah. So generally, what the doctor would do, or your physician would do, when you go to do that test, they would put you in a lying position, normally on your left side, or they could have you bend over to access that gland, all right? To basically feel across the rectum, what the consistency of that gland might be, all right? It could be boggy, it could be, as I said, it could be smooth, it could be firm, it could have nodules and all those things. So that is what a DRE basically consists of. And the thing is, as you said, because of our culture, we tend to, as men, feel embarrassed about getting a digital rectal examination done.
Yes.
Because there's this certain stigma, somewhat that your masculinity, your manlyhood will be violated. If a doctor puts a gloved finger, all right, the doctor would have to put a glove on generally and put lubrication. Yeah. So you'll get a bit of gel as well. Yes. It might sound funny, but some people think that it might be something very, very extremely painful, extremely excruciating, and that is not the case. Yes. So it's just basically the doctor puts in one finger, the index finger, to have a feel as to how that prostate gland would feel. If it is boggy, if it is smooth, or if it is nodular, all right, or if it is hard. The doctor could also get an idea as to which lobe might be affected, whether it be to the right side or the left side, So that is basically what a DRE entails.
That's correct. And based on the anatomy in particular, that's why you would actually access it through the rectum.
The rectum.
Right?
So that is what a DRE or digital rectal examination consists of. In
And
essence.
I know with all the information that we're providing, it's actually more to get to that, more sensitizing the public, not just of the information, but in terms of breaking those taboos. That is what we really want to do tonight. We want to be able to break these taboos, those that false information, so that they would really understand, like, this is the actual way in which the best test, actually the only test,
Yes.
and it's not something that you should shy away, but this is how severe it is, as you talked about the statistics. Can you share a little bit more with us about some of the statistics right here in Grenada that we have? I think last episode you mentioned a few of them.
Well, we had access some of the statistics from the medical records as at the General Hospital.
Yeah.
And over the span of about 10 years, we would have had significant and men being diagnosed with prostate cancer. And also we would have had men who would have died from prostate cancer. In the last year, for a population of 110,000
Yes.
persons in Grenada, we had about 11 persons recorded deaths.
Right.
And the thing is, those are only the recorded deaths that we have, right? You have a lot of persons that stay at home.
Yeah.
They die at home with their prostate cancer, and they're never included in the statistics.
Okay.
So that alone is a very significant number for a small country like Grenada,
Okay.
right? For our little country, is a very significant number
Okay.
of persons, and we don't have to have that number of deaths. It could be your mother, it could be your father, sorry, it could be your uncle and so on that all prone to that. If we detect it at an early stage, then we could always treat it.
Definitely.
Right? And that is the whole idea, is to create awareness so that we detect it early.
Okay, so it's early screening.
Early
so
screening.
that we can detect it early in order to treat. All right.
And even we were speaking about the digital rectal examination. It is so important that the digital rectal examination would help us, especially in not just diagnosing prostate cancer, but also in the staging. All right, and the staging of the cancer is when it's actually diagnosed, and when we have to go ahead and treat and work out the best treatment plan for persons or men.
Okay, so now as we know this, what are some of the risk factors? How can we avoid our fathers, uncles, brothers from reaching to such a state? What are some of the things we can do? What are the information we need to know, the public needs to know? What are some of the risk factors that would make someone more susceptible to that type of to prostate cancer compared to someone else?
So we spoke about risk factors, that was 2 weeks ago.
Yeah.
But we want to zero in especially on prostate cancer. All right. So some of the risk factors, we have what we call the modifiable risk factors that you could maybe try to change.
Yeah.
All right. Those are things that a risk factor is anything that increases the likelihood of you getting a particular disease. All right. So we have risk factors like that are modifiable, which is some things like your diet,
Okay.
changing diet, exercise, and so on. Because based on studies, people that are more sedentary, people that are obese, they tend to have a greater likelihood of developing prostate CA. And not just a greater likelihood, but a more aggressive type of prostate cancer. So some of the modifiable risk factors would be, and by modifiable I mean that things that we could do to change it. You'd be our diet, all right? Stay away from less saturated fats, not to be so sedentary or just sit down at home and not do anything. We could exercise and so on. And we could also do things like, for example, cut down on the smoking and so on, all those habits, because a lot of those things have what we call carcinogens.
Yes.
Carcinogens could promote what we call mutation of the genes. And since cancer is a genetic condition, then the carcinogens and so on, what we get from cigarette smoking, from different various foods, from even radiation and so on, those are the things that would sometimes promote the growth of those abnormal cells. So we want to, in the modifiable risk factors, those are the things that we target. In the non-modifiable risk factors, and those are the things that we use to help us to screen for early detection, we have things like our race. Our race is something you can't change it.
Can't change. It's
If
not
you're born into a particular, if you're black,
Yeah.
even if you bleach your skin or whatever the case may be, you're still essentially black.
Yes, you
All
are
right?
correct. Yes.
So we cannot change race. We
Yeah.
cannot change age. And just talking about the race, the statistics, basically the ratio for black persons or black men to white men is 2-to-1. For every one Caucasian man that is diagnosed with prostate cancer, 2 black men are diagnosed with prostate cancer.
Yeah.
So that is a risk factor that we cannot change, but we could try to detect it as early as possible. So we have race, we have age. Anything over 40 is a risk factor. So once you hit 40 years, then you're at risk for developing prostate cancer. And the older you get, as a man, your risk factor basically increases. I was looking at a study that revealed that 50% of men over 50 would develop prostate cancer. Yeah, so it increases.
Wow.
And then as you advance later on in life, 60 years, the probability increases even more. So we have race, we have age, we have also things, your family background. A lot of us would have had an uncle, a father that would have suffered from prostate cancer. That increases our likelihood of suffering from prostate cancer at one point. And I basically I would have read or done a research, and it says that if your father or if you have a brother that would have been diagnosed with prostate cancer, your chances increase even more than if your father would have had it. So all of those things, your genetic background, your heredity, all of those things play a very significant role, especially in possibly developing prostate cancer posteriorly.
Wow. Okay, so there you have it, guys, all our listeners and viewers. Again, as an African, whether we're Afro-Caribbean, African-American, we definitely are at high risk for many cancers, as we have seen, and that actually it's something that we as Caribbean people are looking, definitely we have to take a serious, stock into these things.
Another interesting statistic that I came across is that Afro-Caribbean men and Afro-American men tend to suffer with prostate cancer more than Africans. So it could be environmental factors.
Very
the
interesting.
research is not it doesn't conclude whether it is environmental
But
factors
there's a
or whether it be
correlation.
the diet or other things that we would that we normally take in.
Yes.
That would predispose us to suffer with prostate cancer more than even native Africans.
Wow. But there's definitely a correlation between that.
There is.
Wow.
So it could be that our lifestyle. It could be location. Yeah, we still yet to determine exactly what is the reason for that. But we generally, as Caribbean men or Afro-American men, we generally tend to suffer with prostate cancer even more than Africans.
Okay, that's a very good point, Dr. Baptiste. Thank you for sharing that with us. What about the high-fat diets? How then can somebody can say that high-fat diets contribute to them having prostate cancer? What role does that play?
Well, the high-fat diet, and we spoke a little bit about it. We spoke about the saturated fats. Yeah, saturated fats generally tend to break down and into bad cholesterol.
Okay.
Cholesterol is what promotes, after it converts into estrogen, it converts into testosterone and so on. All right. There is this particular enzyme that converts testosterone into dihydrotestosterone. All right, and that promotes the growth of abnormal cells as well as normal cells. So it could promote the growth for benign prostatic hyperplasia, which is what we consider adenoma, and it could promote the growth of adenocarcinoma cells.
Okay. All right. Okay, well said. Okay, so those were some of the risk factors for the prostate adenocarcinoma. So then how then would a person know that they are, what are some of the symptoms or signs that anybody can be experiencing that would actually be directly targeting to prostate carcinoma as pertaining to BPH? What would be some of the differences? Are they somewhat similar?
Well, they're somewhat similar and somewhat different.
Okay.
Yes, in the sense that different in the sense that normally when we get signs of prostate cancer or symptoms of prostate cancer is already advanced. Yeah, the thing with benign prostatic hyperplasia, you would get some of the same symptoms and so on, but whenever you detect it is benign. Yeah, with prostate cancer is generally advanced. It's something that maybe a lot of the times when we find men with prostate cancer, they already have back pain, meaning that the cancer might have traveled to the spine or so on, or they already have like blood in the urine, you know. They would have things like difficulty to pass urine, what we call dysuria. They would have even some of them, they come down with symptoms and so on that is not necessarily urinary related. So they would have like shortness of breath or so on if the cancer would have already traveled, or they would have maybe jaundice in the eyes if the cancer would have traveled to the liver. So a lot of those things, especially like the difficulty to pass urine, we will have the what we call hematuria, bloody urine. So we'll have blood in the urine, whether it be visible or not visible. Some of us, especially the older men, we detect or we suspect prostate cancer when we do a urine dipstick, or we do a urine analysis and we see blood in the urine, something what we call microscopic hematuria. Yes, so sometimes that is a subtle sign that we normally see as physicians, that have us thinking about maybe prostate cancer or some sort of prostate disease. So blood in the urine is one of the symptoms again that they experience. Back pain, severe back pain and so on. All right, repeated urinary tract infection. All of those things are some of the signs and symptoms that we experience or we see when we're looking at prostate cancer. Another thing that is important for especially elderly men, sometimes they realize that they cannot, or not even elderly men alone, but younger men, maybe like 50 or so, they erectile dysfunction. They cannot, they have difficulty in getting an erection. All of those things are symptoms and signs of prostate cancer. All right.
Okay. All right. So, Dr. Baptiste, from one of our viewers in the past and questions that was asked, is there any specific tests that you can do, whether it's a blood test? We talked about the DRE, the digital rectal examination, but is there any other blood tests or so that also can be used in terms of diagnosing prostate cancer?
Well, we have the what we call the PSA. The PSA now is because the prostate creates one of its roles, its function is to create enzymes. All right, there are certain enzymes that we could determine in the blood. All right, the prostate we could find it in the prostate itself, and there's a small quantity that we could determine in the blood. So the PSA is short for prostatic specific antigen. All right, it's basically an enzyme that, as I said, circulates in the blood, and when we take a blood sample, we could basically determine it.
Okay.
All right. The PSA could be specific as well. We have what we call the total PSA, which is all the PSA that is basically circulating in the blood. There's a reflection of it. And we have what we call the free PSA.
Okay.
The free PSA, because normally they circulate in the blood and they are attached to proteins. The free PSA are the ones that are not attached to the proteins, and they travel freely. All right, and you have what we call the percentage free PSA. So those values, they basically give us an idea as to what we're dealing with, whether it be something benign, whether it be a prostatitis, whether it be prostate cancer.
Okay. All right. So based on the values here, what would determine, I guess, what would then lead a physician to or more link or lead them to think that it might be more prostate C than BPH, for some of our concerned viewers and listeners?
Well, generally the normal range from the labs and so on, a PSA of 0 to 4 nanograms per deciliter is what we consider to be normal.
Okay, all right.
But in certain cases, especially when you have, for example, family history or so, there are certain physicians that would consider like a a 3.0 or 3.5 PSA to be somewhat high.
Okay.
All right. But the normal range is generally from 0 to 4.
Okay.
All right. Anything like above 4, then we it leads to suspicion of a prostatic disease pathology.
So, all right, so let me ask a quick question. So in a case that you have a first line relative that had prostate cancer, right, and just suffering with prostate cancer, what would be the advised age to take your first screening test?
Well, the advised age, and that again could be it's not something in black and white, right? It's like a kind of grayish area.
Yeah.
But the advised age would be 40 to start screening.
All right.
40 years. But if you have a very significant
worried,
family history,
yes.
for example, you have a brother that is diagnosed with prostate
Yeah.
cancer, you could start even screening at 35,
Right.
at 30 years.
Okay.
Yeah. Because it might just as well be possible, because there are cases where someone would have a normal PSA, and the PSA is normal, but they still have the early stage of prostate cancer. Yeah. So early detection, whether it be using the PSA, you could use ultrasound and all of those things. Those things could basically help you detect it pretty early.
All right, awesome. Okay, so then looking at prostate cancer, we just want to get a little bit more into it. So we talked about the signs and the symptoms. All right. What are some of the stages of prostate cancer?
Okay. So we have different stages, like in any other type of cancer. All right. It is somewhat complex, the staging, based on the American Association of the American Cancer Association. All right. They would have come up with a basically a staging that is very complex. But to the listening public or the viewing public, we want to simplify it.
Yes. Yes.
You have basically 4 stages of prostate cancer. All right. Stage 1 is when the cancer is very small, very minute, and is confined to the prostate. All right. And it could have basically a very slow growth. Yeah. Stage 2 is basically when the cancer is still confined to the prostate.
Yeah.
But it is a little more. It affects a larger area of the prostate. It could be both lobes. It could be one lobe or both lobes. But it has spread a little bit within the confines of the prostate. Stage 3, yeah, it goes beyond the prostate. It could infiltrate what we call the bladder, the seminal vesicle, and so on. But it hasn't traveled basically as yet.
Okay.
Yeah, something like you call metastasis. It hasn't metastasized as yet. And stage 4 is when you would have traveled. You would have invaded the rectum, the anus. You would have invaded the lymph nodes, and you would have even traveled beyond that to even other organs like the kidney, not the kidney but so much, but the liver, and also the lungs and so on.
Okay, so like in case of a gentleman age 70, say for instance age 70, right, he's home. I just want in terms of the diagnosis, right? So he's home, he's usually always in the garden planting, doing his stuff. He's able to walk and do all his things as normal, right? And out of the blue, one morning he noticed that his legs become really, really weak, right? And he can't move anymore. He had to actually be placed on the bed, could not do anything, had to be helped to get to the bathroom and everything, just like that. Noticed a bad sharp pain to the back. All right. In a case like that, what would be most likely you would suspect is happening with a patient like that?
Well, most likely with such an acute onset.
It's an acute onset.
There are many things that we'll have to rule out as a physician, but one of the things that we would definitely have to rule out is prostate cancer.
Okay.
Another thing is that well, as I said, sometimes when we detect it, we already, it's at an advanced stage where we would have traveled to the bones and so on. We would have seen patients coming in with fractures.
Yes.
Something that we call pathological fractures.
Yes.
All right. And the fractures are basically because of cancer that would have traveled to the bones and so on.
Okay.
So they would come in with like a hip fracture, or they come in with the same back pain and so on that you just spoke about.
Yes.
Because of where the lymph nodes and so on are located, it tends to generally travel first of all to the spine, the
Yes.
spinal area. So we definitely, for a patient like that, we'd have to rule out the prostate, any prostate pathology.
Okay, awesome. Okay, all right. All right, so Dr. Baptiste, we basically went through the stages. All right, stage 1, 2, 3, and 4. All right, and we actually talked about in terms of like the spread, right? So we talk about metastasis and where it can go to. So for instance, if you notice, then there is fractures, chances are it went to the bone. If there was difficulty breathing or so, chances are it went to the lungs, etc. All right, so I think we would have definitely got into adenocarcinoma, right, of the prostate very well. What would then be our treatment, first line treatment for someone that is diagnosed with prostate cancer?
Okay, so the treatment is something again that is based on the staging of the cancer. All right. Remember, prostate cancer is not the same thing as what we call benign prostatic hyperplasia.
Right.
It is cancer. It involves cancer cells and so on. So the approach and the treatment will be different. All right. So there are a lot of things that we have to consider in regards to the staging of that cancer. The age of the patient is very, very important as well.
Okay.
For a patient that is 85 or 90 years of age that we diagnose with maybe a stage 1 of prostate cancer, we wouldn't, we might just monitor that patient.
Yeah.
Yeah. We wouldn't maybe opt for a surgical procedure or any sort of radiation or so. So the staging, whether it be stage 1, stage 2, stage 3, or stage 4 of that cancer is what is very important for us to come up with basically a plan. So some of the things that the treatment options that we could wait and monitor. So we would do like yearly monitorization where we take the PSA, we basically compare it and so on, and we do basically a series of PSA over the number of years and see how it is trending. We could follow it with ultrasound. We have what we call the TRUCE, the transrectal ultrasound, where you basically monitor that if it's a nodule or it's just a small mass or so, that area where we basically monitor. So we could have that watchful approach, all right, what we call conservative approach. Also, we could recommend surgery, especially in cancer, for example. As I told you, we normally use what we call the Louison. The Louison is a score that we normally give basically when we would have confirmed prostate cancer.
Okay.
Prostate cancer is basically confirmed. You could suspect it, but we confirm it with a biopsy.
Yes.
Right? And the Louison score basically gives us an idea as to how advanced that cancer might be. If you have a Louison score of less than 6, then most likely is a cancer that is confined or a stage 1 cancer.
Okay.
Right? So the Louison score of 6, a PSA of less than 10, all of those things are indications that cancer might be slow, a cancer that progresses very slowly, and that you might just be able to watch and monitor it. Right? We could have what we call surgical procedure, which is radical prostatectomy, where we remove the entire prostate and remove even some of the lymph nodes and so on. And that procedure, it is based on the type of patient that we're dealing with. A younger patient, for example, 50-something years, that we would have diagnosed with maybe stage 2 cancer or so, might be a better option for that sort of surgery.
Okay.
But mind you, surgery always has complications, right? So you could have things like incontinence, where that person, based on how far they have to resect or take out, that person might become incontinent, meaning that they pass urine on themselves.
Yes.
They cannot erectile dysfunction, all of those things. So it all has to do with the patient that we're dealing with, the age of the patient, the stage of the cancer, and so on. We also have things like radiotherapy. You have brachytherapy, where we insert radiation basically, and those things basically after a time they will kill all the cancer cells.
Yes.
The proton therapy, and you have different, as I said, different therapies that we could use to basically treat. But it has to deal more so with the staging and the age of that patient, right? And what is most also in the management of a patient, we don't just go ahead and select a procedure for. It has to be consented. So if the patient would want to opt for that, anything that would improve basically the quality of life of that patient, we generally tend to opt for it. If it's a surgery that is just going to make the quality of life of the patient worse, then it doesn't make sense.
Yes. Okay. Well, so Dr. Baptiste, we thank you so much for that and all your expertise in terms of, that's surgery and everything. And what I really appreciate also is in terms that we're not just looking at the disease, but you're looking at the individual itself and what is going to be the best procedure, what is going to be the best therapy for that patient. And I really like that, that we're not just looking at just resecting but we're dealing at what is going to be the best outcome for that patient in particular.
Individual.
So I really like that. I like that. So I think for now we definitely would have completed the treatment options for prostate cancer. And if there's any questions, we're asking our viewers and listeners to please feel free to send in your questions, whether it's via YouTube, Facebook. You can also call in. All right, the number is 403-1031. Okay, wow, I got it tonight. All right, guys, so you can feel free to call in. If you want to ask some questions pertaining to prostate CA. Also, Dr. Baptiste is here as well to answer questions even on diseases of the prostate. We really want persons to be aware of what are some of the diseases of the prostate, whether it's prostatitis, whether it's benign prostatic hyperplasia, whether it's prostate CA or prostate cancer, as we would say. All right, so call in, feel free. Don't be afraid to ask your questions if there are concerns of a family member, a friend, a brother, someone that might be having some of those symptoms, a loved one, and they may not be saying anything or they're too embarrassed to go to the doctor. We would like you to definitely, even if it's just to allow them to listen to this video, listen to the video we just showed a while ago. We really want the public to be aware that prostate CA is something that we need to be aware of, but early detection will prevent it from actually occurring, and also it would prevent its early treatment as well. If we're able to treat it, definitely we save lives. Yeah.
The whole idea is to promote and to prevent.
Yeah.
Yeah. Early detection saves lives, and we're trying to break the culture of embarrassment, where someone feels embarrassed to go and see a doctor because of their prostate. All right. The whole idea is to break that culture, that barrier that inhibits people from getting early detection or getting diagnosed early and getting early treatment.
Yeah. And that is something that I do. Sometimes I don't even understand or know how can we really, attract men to actually see the doctor. So this is something that we know that a lot of young women would listen. They would listen to videos. They would, they would find information. So even if we have to target the wives and target the sisters.
And yesterday was Valentine's, so.
That's a good one.
That's
a good one.
Definitely that the man is experiencing some sort of maybe dysfunction, erectile dysfunction, or whatever the case may be. Sometimes that is the most subtle sign or the early signal. So we'll encourage those people to come out.
Wait a minute, Dr. Baptiste, let's get that straight. I missed something there. Maybe that one just went over my head.
No.
Right? You mentioned Valentine. How Valentine have to do with...
No, I'm just saying yesterday was Valentine's. So some of the men and so on that are experiencing those sort of things.
So you mean from the signs and symptoms would have shown?
From the signs and symptoms. All right, any sort of dysfunction or whatever, encourage that partner to go and get the
you never cease to amaze me.
Not only the prostate check, but a general checkup.
Okay then. All right, so that could have been a gift. That could have been a gift.
That could have been a gift.
All right, so I definitely agree with you on that one. That could definitely be a gift, to say, what, let's go do a checkup together. And so I definitely agree with that. Oh my goodness. Oh boy, wow, But guys, yes, we really would like our viewers and listeners to be sensitized about prostate CA. And we just want to thank Dr. Baptiste again for coming and joining with us on Heavenly Medicine to share with us, his expertise, his information on prostate CA and also the diseases of the prostate. Again, we took this time to have another episode so that viewers and listeners can WhatsApp us. They can ask questions. They can, if there's things that they either wanted to know from the past, things that could have happened to other family members, and they wanted to know more information. We're here on Heavenly Medicine. You can call in, you can ask. We're allowing you the time to, Dr. Baptiste is right here, so we're allowing you the time to call in, to message and ask your questions.
The first step is that visit to the doctor. The first step. Every man that is over 40 years, that we already talk about the risk factors. Every man that is over 40 should take that step to get their prostate checked. All right. Even if you're embarrassed about it, we could do the PSA test. We don't necessarily have to do a digital rectal examination. We could. It's not we might be jumping a bit. It's not the best thing to do. The best thing to do might be to get the DRE done and then get the PSA done.
Yes.
But even if it's the PSA that we start with, is a step in the right direction. It's all part of screening.
Yes.
And the idea is to get out there and get screened. Right? Get the DRE done, speak to your doctor, or get a PSA done. All right.
And Dr. Baptiste, one of those questions too, like a lot of persons have this concern. They will be like, okay, well, I was once diagnosed with BPH. Can BPH be converted into cancer?
Well, based on literature, yes.
Okay.
There are certain, especially when it's in an advanced age with the other risk factors, as age goes along and so on, it could result in prostate cancer as well. Adenocarcinoma.
All right. Okay. All right. Because again, certain, as we talked about in terms of inflammation of the prostate, when we looked at prostatitis, sometimes due to this inflammation, you see a high level of the PSA right? Level. Which is sometimes a little bit more than if it was cancer or BPH. Sometimes you can see that.
Interestingly enough.
Yeah.
And whenever you're going to get your prostate checked, or if you're going to do the PSA, there are certain things that that could increase the level of the PSA. That is normal. Ejaculation. So normally when a person is going to do a PSA, you would advise them not to maybe have intercourse the day before or whatever the case may be.
Okay.
Even things like cycling and so on, based on the activity, it could cause a bit of stimulation, and that could create a bit of like the PSA itself could elevate in the blood. So PSA is not always the safest thing to go by, but it's one of the standards that we use for screening. All right. And if that PSA is high or whatever, we take it from there. If we have to do whatever ultrasound, or if you have to do a CT scan or MRI, we will know. But the first step is to get to your doctor and to get screened.
Wonderful. Okay, guys. All right. So thank you again, Dr. Baptiste. We really
Dr.
enjoyed having you again. I mean, it's just always a pleasure. So we just want to thank you again for being with us, for joining us here on Heavenly Medicine. We also want to thank our viewers. Thank you so much, guys, for tuning in. Thank you for listening. Thank you for sending your comments. We really appreciate you. We hope that this information would not just stay within our Trial Island state, but it also would be spread worldwide. It's a great concern within our community, but also worldwide. Prostate cancer is something that we really want viewers and listeners to be aware of and to be sensitized. We really want to sensitize the public about prostate CA, and that early screening will save lives. So again, tonight, I just want to say thank you guys for listening. Thank you for joining in. A blessed good night to you all. I just wish you a pleasant good night. And Dr. Baptiste, would you like to wrap it up by saying good night to your viewers and listeners? I'm sure many of your supporters have been listening and, sending their comments and so.
Dr. Louison, I think that's provocation. I'm just kidding. But once again, thank you to the listening public. Don't forget to, even if you aren't tuned in now, but you could always look at it later on. subscribe to the page, because there are a lot of very interesting programs. Not only this one that you're listening tonight, but there are a lot of other interesting programs, especially on this radio station. All right, I want to thank Dr. Louison for having me here.
You're most
My
welcome.
dear friend. I want to thank Hope FM.
Yeah.
All right, and I think the population is growing, because I just recently I've been getting feedback that, you know, and I was kind of startled. I was surprised. I didn't realize so many persons were tuned in. Yeah. So I just want to thank you for the public, for the platform to share about prostate cancer and prostatitis, BPH, and so on, and whatever health topic. Whatever. Feel free to always welcome me back.
All right.
Already have a growing fan base.
Guys, you hear what's going on here?
So thank you all for
definitely.
listening. Thank you all for listening.
Okay, guys. So again, have a good night. Be safe, and you are listening to Heavenly Medicine on 103.1 FM. Have a blessed night and take care of yourself.
If you could just play that video one more time on exit.
Yeah, that would be really good. Okay.
Embarrassed. Too embarrassed to speak to a loved one. Too embarrassed to speak to your doctor.
Too embarrassed. When in our lifetime, 1 in 4 black men will be diagnosed with prostate cancer. 1 in 12 black men will die from prostate cancer.
Let me repeat that. 1 in 4 black men will be diagnosed with prostate cancer. 1 in 12 black men will die from prostate cancer disease.
1 in 12. That could be your dad, even your older brother, uncle, or grandfather.
You need to make sure they are not embarrassed to speak to you or their doctor about it.
Hey, Dad, have you had your prostate checked out? See? How hard is that? It's easy. Just start the conversation.
Prostate cancer is survivable if caught and treated early enough.
Don't let embarrassment stop you having this important conversation.
You may save someone's life.
Not just your own.
and fail.